social care. The budget for adult social care is one of the largest in the council, Madam Mayor, at approximately 40% of the general fund. As it is one of the largest budgets, the cuts from the Tory government have hit us, the people of Thurrock, very hard indeed. On page 52, you will see the effect of these cuts in black and white. The spend per adult person has gone down year on year. You will see, Madam Mayor, that in 2008 and 9 we had £1,539 per adult person, going down year on year to £1,213,122. The latest figures, Madam Mayor, for 13-14 is £1,106, continuing to shrink every year. That's almost 30% less money to spend on our older residents at a time when we are living longer. We should have more to celebrate, but year on year we see this unwelcome reduction in our funding. A similar picture can be seen from adults with learning disabilities, with an even bigger reduction in spend on this group of our residents. We've acted swiftly and positively to address these government cuts, with new community-based services being created, such as our rapid response and assessment team, which has seen an enormous increase in demand. The team is made up of clinicians and social care practitioners and includes COPD, that's chronic obstructive pulmonary disease experts, and dementia care expertise. The team deal with over 300 referrals a month, see over 83% of referrals within 2 hours, and only 2%, Madam Mayor, of the 300 end up going into hospital. A remarkable achievement, a remarkable team, and very valued by the community. Local area coordinators are also really paying dividends in their communities. The recent evaluation, soon to be published, has shown a profound impact on loneliness, with many GPs noting some of their regular attenders no longer regularly coming through their doors. With the reduction in funding, Madam Mayor, of our adult social care, transformation agenda has been a crucial part of our provision. We're working closely with our health provider colleagues to complement access arrangements, as I've described with the rapid response team. We're also evaluating and exploring ways to optimise our in-house provider services, looking at all options available to us, including more spin-outs, and that's the such as TLS, Thurrock Lifestyle Solutions, which has proven to be absolutely fantastic. The depth of shared concern is such about the quality, safety and sufficiency of social care services that national organisations from across the public, private and voluntary sectors have made an unprecedented joint statement to the government to be considered in the 2015 spending review on behalf of the estimated 1.9 million people using these services. These include organisations such as the NHS Confederation, Directors of Adult Social Care, the National Care Forum, Age UK, Carers UK, and many, many more, Madam Mayor, that are really concerned about that market. The provider market is under extreme financial pressures, and with the introduction of the increased living wage, which looks very good on the surface, which will leave many worse off due to falling tax credits, we've seen many of our providers decline to do business with us, giving us a big problem with domiciliary care provision in our borough. We're working hard to ensure our residents have much choice to retain their independence as possible, such as schemes like Derry Avenue and Elizabeth Gardens. Public Health, I'm extremely pleased with the appointment of the Public Health Director, Ian Wade, who is a man after my own heart, dealing with some of the poor health outcomes seen in Thurrock wards. Unfortunately, once again, not everything in the world of public health is rosy. We've seen in-year cuts with the government telling us that we're going to get 6.2% reduction, which amounts to nearly £750,000 in year, Madam Mayor. Is this going to set a precedent for ring-fence budgets? We hope not. If you okay, GPs are managed by the NHS, as we know, and I don't believe that we're getting a very good service from some of our GPs in Thurrock. I've been working closely with the Care of Health and Overview and Scrutiny, Councillor Snell, to hold the NHS to account. And NHS England have admitted that we do have a crisis in some of our wards in Thurrock. I'm also concerned with the low number of health checks that some of our GPs are signing up to and not performing. We're working closely with the NHS to explore the opportunities to develop health and wellbeing centres across Thurrock, and I hope to bring some news back before Christmas of some plans from NHS England. And finally, finance. We're working hard to ensure that our budget comes in online at the end of the financial year, Madam Mayor, and I'll be happy to take questions.
Thank you, Madam Mayor. And thank you, Councillor Rice, for your presentation. Madam Mayor, sorry, I thought Councillor Halden was going first. But Madam Mayor, I just wanted to put on record the fact that this afternoon we had the Thurrock CCG had their annual general meeting, but I can understand that we're all very busy, so not many people attended. I think Councillor Gupta and I were the only representatives of Thurrock Council, and of course the director in charge of that. But there were a lot of things put forward by residents about healthcare, which I'm sure the portfolio holder will be picking up. But specifically, I think 2 years ago, November 2013, I proposed a motion about GP services in Chapel 100 to make sure that that was put in the Essex-wide plan. I haven't heard anything since then. Can the portfolio holder please provide an update for me and, of course, residents of Chapel? Thank you.
And you haven't heard anything since 2013 because you haven't attended very many meetings to get the update. Of course, what I was talking to you about earlier with NHS England and their plan is not only for the likes of Tilbury that we know are suffering immensely and have a crisis in Thurrock. It is around all GPs, looking at the numbers of residents that are actually on the lists. We know from those lists that some are very much under their numbers, and we know also from those lists that some are 3 times their numbers. It is a matter of priority, and I'm sure that NHS England will look at all areas. However, it will be the list of 6,000 plus per GP, when the national average is 1,720, that will possibly be looked at first, Madam Mayor.
The draft estate plan the NHS is going to publish for GPs in Thurrock in December seems that it could be a very promising piece of work. The portfolio holders reference problems that we have with certain GPs, either being single-handed practices or having lists that don't really conform to what should be normal. But does the portfolio holder agree that beyond just making sure the lists are right and improving GP facilities, that has to go hand in hand also with weeding out GPs that do fall below the standard that we would expect?
No, Councillor Howden, Madam Mayor, that lots of, well, a few of GPs in Thurrock are in special measures, so there is a system. And of course, it isn't my job to read them out, but there certainly is a national system whereby GPs are held to account. And I certainly agree, Councillor Howden, that I agree with that proposal.
Thank you. Councillor Baldwin? There's for much needed adaptations to their homes.
Thank you, Councillor Baldwin. Yes, indeed I can. Unfortunately, there is a national shortage of OTs, that's occupational therapists, and we in Thurrock are not immune to that situation. Like most professions, nurses, doctors, occupational therapists, there have not been enough people put through a training process, which is now a 4-year degree programme, to come out the other end to fully service our nation. So unfortunately we are having long OT waits. We have 3 vacancies at present. We have done a recruitment campaign to try to get new people to come into post in Thurrock. It's very difficult to recruit, not only to Thurrock, as I've said, that's a national problem. We've gone to even out to agency, and unfortunately we haven't been successful. So, Madam Mayor, it is very unfortunate at the moment that we're in a situation. We do have a plan, and we are monitoring that plan, putting it into action, moving people around in teams, etc. And I'll be more than happy to share that with Councillor Baldwin. We do accept that there is a problem at the moment, and there is a plan to move forward with it. Thank you.
Thank you, Councillor. Councillor Warren? Thank you, Madam Mayor.
I'm going to go back to doctors' surgeries. It's been well publicised that healthcare for my residents in Tilbury is at a crisis point and needs to be addressed as a matter of urgency. What commitment can you give me as the portfolio holder so that I can speak to my residents that you and officers are taking it seriously and that we can hope to see a better health provision and the improvements to happen quickly as winter is just around the corner? Thank you.
And I think that's a really valid point and one that needs a very thought out answer. Actually, we have arranged a public meeting for the residents of Tilbury. I know that the councillors are being invited to that, and indeed, I think you're being asked to chair, Councillor Wall. You'll be pleased to hear. Along with our colleagues from NHS England, from the CCG, and indeed our Director of Public Health and Director of Adult Social Care. So residents can actually have their say, have their voice, and let us know exactly how they're feeling and how they're finding it in Tilbury, not just stats on a piece of paper. There is a crisis in Tilbury with GP provision, and indeed we have urged NHS England to move on Tilbury, and that was my point to Councillor Ojitola, that there is a crisis in Tilbury and those areas do have to be dealt with first, and you'll have your chance. I believe it's next month, Councillor Worrell, when the meeting is set up, to speak first hand to the head of NHS England and make your point and your residents' point very firmly, a point well made. Thank you, Madam Mayor.
Thank you, Councillor Rice, for your report. It's a shame that you feel that it's a glass half empty report, because I do see some really good successes here. As you quite rightly pointed out, the rapid response and assessment team being exceptionally successful. Obviously, this has been driven by the reduction in grants to local government to the amount of money we can actually spend. So obviously, you know, this is a bit of a success from what you view as a bit of a tragedy. But can you assure me that you will be applying those same kind of really good and congratulatory thinking to the reductions in public health grant to make sure that money can be better spent? And we can still achieve such great outcomes as we have done in the rapid response assessment team.
We've reported on this tonight, Councillor Glenhill. Thank you very much. Of course, we're looking at everything. We're not leaving any stone unturned with everything that we're looking at. And of course, there are different models that we can use and that we will use. And of course, overview and scrutiny have been very, very helpful with suggestions. Unfortunately, when we have in-the-year cuts through public health, that's very, very unfortunate because these services are already accounted for and the money's already accounted for. So it makes it very difficult then. I just let you know that when public health first came into this council, every single contract was looked at very, very thoroughly, as you've suggested. And indeed, lots of alternatives were found and lots of money saved from the old PCT style of management. So, yes, thank you for your comments.
Thanks, Madam Mayor. I'd like to refer back to the estate tragedy that Councillor Howard referenced, which is obviously a key opportunity for Thurrock to show leadership and work with partners in NHS to shape a better future. And you broadly mentioned that it may be happening in some of the partners in there, but can the portfolio holder outline what outcome the council is?
Yes, I can. We're hoping for excellence in our healthcare provision for the residents of Thurrock. And we're hoping that that excellent healthcare provision is going to reduce the very, very unsatisfactory health inequalities that we see in our borough. That's the outcome that we're hoping for.
Thank you, Madam Mayor, and thank you, Councillor Rice, for an excellent report. A person's circumstances, so their family situation and financial situations have huge impact on someone's physical health, but also their mental health. I found residents in my area that the welfare changes the government have forced on residents is making a massive difference to their mental health, to their stress, their anxiety, to their family situations. I was just wondering if Councillor Wright...
This is one of our services that continues to have continued use and more demand placed on our services. Councillor Holloway is absolutely right that stress of modern day life, living arrangements, you know, if you can afford to pay your bills, etc., puts increased pressure on our residents. So indeed, like all services, our mental health services are under pressure, the same as they are across the country. The state of our mental health services are, I believe, fair. I don't believe that they're brilliant, and I don't believe that they're poor. I believe that we provide a fair service in what indeed is a very, very difficult and challenging climate at the moment.
I was very pleased to read the chart for older people, which we recently signed. And it raised a lot of expectations of the older people in the borough. And looking at your report and showing the decline in the social care budget, what sort of impact do you think it's going to have? And how the older people are going to believe what you pledged to them in the charter?
For joining with me, both developing the charter together and launching that. And if you read the charter very carefully, Councillor Gupta, you will see that there's not very many cost implications within that charter. It's all about giving people rights to have dignity and respect, and also nothing to be decided without full consultation, so nothing about me without me. And of course, as you know, I am one of those older people, Councillor Gupta.